We had a bit of a scare with our 13-year-old mixed breed dog. We had her DNA done, and that's going to be a separate episode. Let me tell you, she's a crazy mix. Our daughter, who works at a vet and studies canines, says no one would ever intentionally combine her breeds. She resembles a small lab mix, best I can describe her. She's around 30 pounds and has always maintained good health without problems or concerns. We were told by the person my daughter adopted her from that they thought she was a cattle dog and a Rhodesian Ridgeback mix. We went with that and even felt she exhibited some behaviors from those breeds. Focused, determined, herding type tendencies, very fast runner, climber, distance runner, fetching, jumping, playing with balls, playing with frisbees, obedient at 13 and still learns new tricks, doesn't know when to stop, quasi-obsessive with fetch, etc. She's smart, she has a great memory, still trainable even at her age, and most importantly, she is loyal. She loves us deeply, and she means the world to us. She has our hearts. Like I said, I'll do that separate episode on her DNA. Try to guess what she is, and see if you're right when the episode comes out. I'll include the results, the process, how much it costs, what percentage of each breed she is, etc. And it's not just for fun. Knowing the breeds also helps you prepare to know what to expect. For example, her condition that I'm going to cover in this episode is at higher risk for certain breeds, including boxers. Early detection of life-threatening or life-altering conditions is just as important for our pets as it is important to humans. Early detection saves lives. Here's Kaya's story of success. There's no sad ending here. It started with a lump on her foot, and it grew quick. It was round, on the paw, about the size of a grape, and kind of squishy to the touch. The hair remained growing normally over the mass. She didn't pay any attention to it. There was no licking or chewing or sniffing on it, nothing. She didn't limp or seem like it bothered her a bit. She seemed more lethargic and was hiding in other rooms under furniture, etc., acting off, and we weren't sure if there was a connection. After Googling it, it seemed like it was probably a growth and hopefully not serious. We erred on the side of caution and needed an actual expert's opinion. Even though it may be costly, we knew she deserved it. We lined up a pet insurance, as recommended, and started the process. We informed the doctor we want the growth removed and biopsied. We didn't want it to grow even bigger. We didn't want it to eventually affect her by the sheer size of it, even if it ended up being benign. Step 1, get meds to keep her anxiety down and schedule the vet appointment. By the way, after back and forth and the runaround with her pet insurance, meds were not covered at a cost of $52. Next was her exam and treatment plan. That appointment cost $116. Insurance only covered $50. Next was the big day. She had to arrive first thing in the morning and stayed all day till after 4 p.m. She was very drugged up. Oh, that reminds me. Here's a funny story amongst the concerns. By the way, I was emotional and worried during this ordeal. We gave her PM meds and AM meds. The vet injected a little more upon arrival. They threw a blanket over her, gave her a shot in the backside. Bobby laid down comforting her and was laying with her on the floor while she was on the blanket. She slowly faded out, and the assistant came back, and Bobby said, "Goodbye for now," as they pulled her down the hall on the blanket, still passed out. All went well, and she was groggy, of course, when she got out. She slept till the next day. Unfortunately, she peed in her bed, and she was very hungry when she woke up. You'll see in the pictures how she was bandaged, but still able to walk uninhibited. My sister calls it the Q-tip wrap. She handled her recovery well over the next few days. We followed post-op instructions in the order listed, including keeping the cone on, removing the IV bandage, providing necessary meds on time, and also trying to get her to drink water, as staying hydrated is important. After several days, it was time to carefully remove her surgical dressing. Bobby, of course, was gentle and carefully removed it. He did such a great job. He has a lot of practice being a nurse around here. The wound looks great. You can see the stitches, and the stitches don't require any removal. They will disintegrate on their own. We tried to give her a little break from the cone. As you can see here by the look on her face, she's not a fan. She immediately tried to lick it, and luckily within days, the redness went away and the fur quickly grew back. Finally, no more cone. And her foot looks real good. Give me your foot. Let me see it. Oh, it looks a little different, actually. We'll here, brush her teeth. She had a good tooth report. Darn dog. Just won't leave her wound alone. Not good. She's super close to me because I'm having a stern talk with her, and she doesn't want to be in trouble. And I do love her, but if you compare those last two pictures, she's obviously been licking it because there's some hair gone and it's puffy and red. So hopefully she doesn't have to get the cone back on again. Gonna have to keep an eye on it. She's past the amount of time that they said she had to be, but she has a bad habit of licking things to death. We love you, girl. Let's go over what all they did for her and how much it cost, as well as what was reimbursed by the pet insurance. There are many reputable pet insurance companies. We chose ASPCA on the cost and familiarity. Here's an invoice covering all her procedures that day. Directive for CPR, no cost. Anesthesia dentistry, $199.05. Nail trim under anesthesia, free. Dental evaluation and cleaning, $458.50. Fluids dentistry, $165.60. Hospitalization dental, free. Includes patient care while at the hospital. Full mouth dental x-ray canine, $308.80. Surgical mass removal, $482.50. Histopathology, initial site, $408.65. Bandage applied during surgery, free. Vet scan prep profile 2 plus CBC, $232.65. DA2P PV vaccine, 3 years, $59.55. Rabies vaccine, 3 years. Canine, $78.15. Amoxicillin, 250 milligrams. Capsules, $49.21. Client received verbal medication consultation, free. Carprofen, $50.45. Another consult. Elizabethan collar clear, 25 centimeters. That's her cone, $7.61. VCA Charities donation, we donated $2 for a grand total of $2,502.70. Submitted to the insurance, and eventually and finally, after many phone calls, they covered $1,548.69 of it, and the rest was on us. Her dental cleaning went well. It's so satisfying to see these before and after pictures. I just love it. Even the x-rays looked good. The summary of procedure performed. There was dental charting and full mouth intraoral radiographs, which is x-rays. And in the findings, it says she has 0 to 1 periodontal disease overall, based on probing and x-rays. She has mild to moderate dental calculus and minimal gingivitis. Her dental x-rays look good and no extrications are indicated. That is so good for an old girl like her. She's 13. They gave instructions on like how quickly she can be active again, what she should and shouldn't eat, and her follow-up appointments, what medication she was going to be on, all that good stuff. They talk about preventing her from chewing for 14 days, obviously, on the incision area. It says they were able to dissect out and remove the mass on her left front paw, send it out for analysis. They were not able to get a wide skin surgical margin to allow us to close the skin incision after. They trimmed her nails. She was sleeping, performed a complete exam. Her pre-op lab work looked fantastic. That's all her blood work. Her exam was otherwise normal. Her ears were clear and did not need cleaning, and her toenails were trimmed. We updated her DAPP vaccine and noticed her rabies vaccine was due. We already got that done. So they updated that as well while she was sleeping. My favorite part, they say she was a brave girl today. So precious. We had to wait for the pathology, hoping and expecting the best. Here's the pathology info. Low-grade cancer expected on 4th digit of front paw. Three centimeter SQ mass, soft tissue sarcoma, grade 1. Suspect myxofibrosarcoma. Complete excision cannot be confirmed. Comments list the cancers encompassed in their type, including malignant nerve sheath tumors. Reoccurrence is expected, meaning unfortunately it will most likely come back and need to be removed again. Cells are described as poorly defined borders. There are a bunch of other big doctor words on there that I'm going to steer clear of. Nuclei are oval to elongate with finely stippled chromatin, 1 to 2 nucleoli. Say that 5 times fast. Lymphocytes and plasma cells are scattered throughout. The neoplasm extends to the radial and deep inked histologic margins. There was more medical jargon beyond my comprehension. It's all there if you'd like to dive deeper. Her follow-up is in 6 months. You can see how good she looks and how good she's doing and how well it's healing now. Unfortunately, even though it is removed and caught early as low-grade cancer, it will come back. It will be slow growing, and we'll have to remove it again later if we so choose. That's the best we can do for her, so we will. We love her beyond words. She is our world. We want her around, happy and healthy as long as possible. So far, so good. A little bit of bad news. You can see she's got a cone. For the last couple of days, we've been doing this. Because as you saw in the pictures, she can't leave well enough alone. Let's look at it today. Let me see your foot. Let me see your foot, honey. Show me your foot. Show me your foot. Oh, she doesn't want to show me. Let me see your foot, hon. Let me see your foot. Let me see your foot. Because she knows when it's this, it's for the medicine. Let's see your foot. Oh, it's looking pretty good. It's looking pretty good. The hair's coming back. Let me put a little medicine on it for you. I'm sorry. I know it's not fun. We're going to try to do a little natural remedy on her paw. Apple cider vinegar.
Thank you.
Less red today.
Do your nails. There you go.
And then he's going to put a little Manuka honey on. It's super sticky, and we're not going to cover the bandage. Come here, honey. And then he has to put her cone on, otherwise she'll lick it off because it is honey. Come here, let me see your foot. Come over here, babe. Come on. Come over here. Manuka honey is very good for healing and antifungal, antibacterial, antiviral.
Here we go.
There you go.
Come on.
It's time to use the apple cider vinegar on her surgical wound. And then instead of Manuka, which really helped, you can tell already, we're going to do the animal scent ointment from Young Living, which we've used for other skin things for her before. And then we have to put the cone on again because she will lick it off. That's a lot, Grandpa. All right, hopefully it'll be better tomorrow. Good doggy, good baby. She's such a good girl. She trusts us with everything. Our girl's a hit. We did a cute little video of her helping us open presents, and she has over 1,000 views. The happy dog here because she got her cone off again. Show Grandma your foot. Not that foot. That one's fine. Show me the hurt foot. Yeah, there's that right. It's looking good. Look at the hair's coming back. Those all natural things really, really work. Now I just got to keep a close eye on her. She has bad habits of licking. We'll still do the treatment tonight, probably with the apple cider vinegar and then the Young Living animal scent ointment. She's been such a good girl through this. Let's give her a dog biscuit treat. These are her Christmas presents. We just keep them in this for freshness. Let's see if she'll do a couple tricks for us first. Sit. Oh, good girl. Shake. Left hand. Shake. Good girl. Shake other hand. My hand's over here to shake it. Good girl. Lay down. Down. Lay down. Good girl. Last one. Up, up. Up, up. She's super smart. She knows way more tricks than that, too. And we had a comment in the episode where she was unwrapping our presents, and the person was concerned that she won't know the difference and not go chew up other stuff in the house, knock on wood. But she's such a good dog. She waits for permission for anything she does, just about. Love you, honey. Was that a good treat? You're a good baby. 13-year-old senior dog. She'll be 14 this summer. Love you, Kaya. Family from out of state is sending her special get well treats. Everybody loves sweet little Kaya. Can you tell by her tongue she's ready for her treat? Okay, let's set it right here. Shake. Good girl. Other foot. Good girl. Lay down. Lay down. Good girl. You gotta get your treat from that Riri. Say thank you. I love it so much. She was all excited there was actually something in the mail for her today. When it rains, it pours. Now our girl is having hind leg problems. We have her on daily glucosamine supplements as recommended. She already has an orthopedic bed. She will continue to exercise with walks and play. We're doing heat treatments, which also helps her. And here are some more helpful tips, including weight control, which thank goodness she's always been at a healthy weight. It does mention minimal vaccinations, which I found interesting, and I did do further research on that as well. Herbs and antioxidants are also helpful. All I have to say is some days are better than others, and getting old can be really rough. Several months have passed, and here's the latest. We have taken a few road trips with Kai, and they went well. She has still been taking her daily supplements. Unfortunately, in the middle of all this, Bobby broke his leg and was off work. We're all making plans for another vet visit, including x-rays. And sedation, of course. It'll be a pretty penny. Insurance will help, and she's worth every penny. It's hard to see our beloved pet's age. We're doing our best. She'll be 14 in August of 2025. Who knows? She could have another 7 years with us. She's always been healthy. She's never been overweight, eats healthy, appropriate food, and natural supplements. For now, we will keep trucking together, expecting the best. We love you, Kai Kai.
If I can't keep my head held high enough, I'll just speak love and watch the smiles come.
Thanks for watching.
Bring my spirits up.
Don't forget to stop and smell the flowers.
There's some shit I like to fix, but I still